Okay, so when it comes to hormone replacement therapy, there's a couple of things we have to note. First and foremost, it is extremely individualistic. Not only does everyone respond differently and feel differently at different levels of serum, different levels of free hormones, and metabolize the hormone or the medication at different rates, whereby a 10 milligram administration on you may bring you here and it may only bring me here. There's so many variables when it comes to hormones that it's literally a trial and error game. Now, if you have a competent provider who's fairly experienced, okay, and they have a good knowledge base of case studies that they've done with other patients, they're going to be pretty efficient at dialing you in fairly quickly. It does not negate the fact that it still requires a dialing in period. And this relies on patient feedback to achieve symptom resolution, combined with lab work every 8 or 10 weeks or so to make sure that we're not causing harm in the process. This process is delicate, it's essential, and it could be a blessing, but it could also be a nightmare if done incorrectly. So if I give you a pellet, which is a minimally invasive procedure that takes the hormone and essentially puts it in a capsule that is inserted underneath the skin, and it's designed for a slow dissolve and slow release of a hormone, we don't know how quickly you are going to metabolize that hormone or what levels of hormone you're going to achieve. We're basically guessing. Now, we're always guessing with an educated background. However, if we guessed correctly with a pellet, that's great. More often than not, we don't know that until you've actually gone through a course of several weeks or months. Usually you're going to guess incorrectly the first time, and it's going to require an adjustment. If I guess incorrectly with a pellet, you are stuck for 3 to 4 months. You're going to feel suboptimal at best, and you're going to feel terrible at worst. And you may even experience some side effects, especially for women. When using testosterone pellets, you may begin to experience virilization symptoms, deepening of the voice, facial hair, enlarged clitoris. There's a lot of virilization symptoms where, if caught early enough, can be reversed. The longer you stay the course, the more irreversible and permanent they become. With a pellet, you do not have the luxury of making adjustments. You're stuck. Now, if I give you a form of administration, let's say like cypionate, the administration process on average is going to be twice per week, which is a pretty ideal cypionate protocol. This means that every 3 days, I have an opportunity to adjust levels, doses, and even change the frequency if needed. This is going to be based on patient feedback and response, as well as labs. So if a patient says, look, I've been doing this for 3 weeks and I feel okay, we can see what's going on and maybe tweak and adjust. If they say I feel terrible, we have the luxury of making a full U-turn and readjusting again. So having that control, especially early in the game, is so crucial. And giving up that luxury for the sake of a pellet is just silly. Now, I'll explain to you from a clinical standpoint, because I do run 4 clinics, why pellets are pushed. Pellets are pushed because they're great money makers. Insurance companies pay for procedures and office visits. They do not pay for education of patients. So they're not going to pay us for explaining to a patient how to administer medication and then sending them home with the medication. They will pay handsomely for a procedure of inserting a pellet. I have heard, and even on a cash basis, I have heard of patients or providers being paid anywhere from $800 to $4,000 for a pellet treatment, okay? So naturally, from a business perspective, they're trained to sell this product. And I think a lot of people would be very surprised to learn, because I could tell you what it costs from the pharmacy. Oftentimes, you're going to need several pellets. I think women on average are going to go, 8, to 12 pellets perhaps. I know men can go, north of 20 pellets in an implant. A pellet is $20. That's it. It costs $20 to the provider to order a pellet from a pharmacy. So if I give you 10 pellets, it's $200 worth of medication, and I may be paid $3,000 for that procedure. So naturally, your provider is going to tell you pellet's the best way to go because they're making a killing, okay? But I care more about patient health and longevity and a relationship with that patient. And ultimately, we take an oath to do what? Do no harm and benefit that patient as best as we can. Now, if a patient recognizes the benefit, they have the option to pay for it out of pocket, and it's going to cost them significantly less, probably 75% less for the year, to go about it another way, and it's actually a better way medically. So at the end of the day, patients are going to appreciate the flexibility of adjusting their protocol accordingly as opposed to being stuck there, okay? If you've never drank alcohol before, Steve, I'm not gonna come up to you and say, look, I want you to have 2 glasses of vodka, go out on a drive and let me know how you do and hopefully you won't crash, okay? Because if you did that once and it didn't work, you're gonna stop. But what if I said for the next 4 months, I want you to do that every single day and you don't have the luxury of stopping? Well, if you had a bad reaction, too bad, you got 4 months of hell. And that is essentially, in a nutshell, what pellets are. Now, I do want, while we have attention on this, to clarify one thing which really, really irks me. The word bioidentical. This is a word that has been pushed so much on women in the hormone replacement therapy arena. Bioidentical does have a scientific meaning, and I'm going to briefly explain what it is. It has nothing to do with the form of administration. And it is being touted as a marketing term to scare women out of a less lucrative treatment and into these lucrative treatments by calling them bioidentical. Bioidentical simply means, when you break down the word, bio as in biological, meaning living organism, and identical. Your body recognizes a bioidentical hormone on a molecular level, okay? So testosterone has X amount of carbon atoms, X amount of hydrogen, and X amount of oxygen. That does not change. All testosterone is the same. All estradiol is the same. It is all bioidentical. The form of administration, whether it be pellets, whether it be creams, or any transdermal, or whether it be cypionate or injections, is all bioidentical. Don't let someone tell you an injection is synthetic and not bioidentical, and a pellet is not. The word synthetic is another one. People are afraid of it. To synthesize simply means what? To form. Your body synthesizes protein every day. It takes molecules and forms a compound. This is what the word synthetic means. It is not a bad, scary word. So yes, all hormones that we take exogenously are synthetic because they are produced, but they are still bioidentical molecules. So stop thinking that your pellets are bioidentical and your injections are not. It is false, it is marketing rhetoric, and it is designed for profit. So when you understand that, you can start approaching your health with more autonomy and more understanding to benefit you, and stop lining the pockets of the companies putting out this nonsense.